Okay, my name is
Right.
Sherry Clark. I am the chair of the Northborough Youth and Family Service Commission. This open meeting of the Northborough Family Service Commission is being conducted remotely pursuant to Chapter 22 of the Acts of 2022, an act relative to extending certain COVID-19 measures adopted during the state of emergency signed into law on July 16th, 2022. All members of the Northborough Youth Service Commission are allowed and encouraged to participate remotely. The act allows the Northborough Youth Family Service Commission to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream of this meeting may do so by going to Northborough Remote Meetings on YouTube via the link listed on the agenda. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting. Are we featuring any public comment this meeting? Thumbs up, thumbs. Is anybody able to answer that question? Are we featuring public comment during this meeting?
I don't believe we are.
Okay. All right. The chair confirms that the board members and persons anticipated on the agenda are remotely present and can be heard by stating the following. Members, when I call your name, please respond in the affirmative. Erica Zeiger,
Yes.
Gretchen Bean,
Yes.
Gilly Nachum,
Here.
Jennifer Lipton,
Here.
June David Force.
Here.
Okay. I think now we just need somebody to motion a call to the meeting to order.
I motion. Call
I'm
me.
second.
Okay, so we have the first thing on our agenda states the date of the next meeting, which is June 15th, 2023. And then we have a review of February meeting minutes. Did anybody have any comments that they would like to state about the minutes from February 16th? Okay, would somebody like to motion the minutes approved?
Motion to approve the minutes.
Second.
Okay. The minutes are approved. And with that, June, I'm going to turn it over to you for your
Okay.
director's report.
Great. So I wanted to let you all know that I'm going to be getting a gift and a thank you card for Sandy and for Casey. I don't know if you know, but at the annual town meetings, they call out the names of people who've served. And so I believe they get something sent to their home, but I also thought it would be nice for it to come from us. So just wanted to let you know that. Landon, you're here? He's not here?
I think Landon was logged in and has since had to leave.
Okay, so on March 8th, the Encompass Group, which I've talked about here, it's Southborough and Northborough working together to combat substance abuse amongst youth. And that night, we all had, the Encompass Group had an orientation for potential new members. And Landon came as a student. And we did a lot of interactive things like walking around the room and joining smaller groups. And he was phenomenal. He was sitting at a table and people were rotating. And it's like he was the king. And people were coming to him. These were all adults. It was just amazing to watch. So when I see him, I'll thank him again. But he played a really good role in it. He was very important. I was very proud. So I want to talk about the town meeting. I don't know if any of you got a chance to go, but since I've been here, it was probably one of the smoothest meetings and friendly meetings. Even though people disagreed with each other, it was very respectful. You know, in the past, we've had some testy residents but it was just a phenomenal meeting. It really went very well. And it was the first meeting with a lot of new members, select board members, and couldn't ask for anything to go better. I was really impressed. They also had the big ticket item was with the schools and building that the sports complex that they're going to build at the high school, and that passed. There also was some questions about ARPA and how the money's going to be spent. And a woman came up, I'm not sure who she was, but she spoke about those forums that Sherry that got started in town and what people prioritize as the priorities in town, and that it was mental health was number one. And you know, she was well-spoken, and I'm glad it got brought up. It's probably the first time mental health has been brought up at the meetings. So yeah, did anyone get to watch it or hear anything about it after? Okay. So I wanted to talk about, oops. There we go. I wanted to talk about this year's annual report. I don't know if everybody got a copy of it. It's like a calendar. You can pick it up at different places. And so this year, what I talked about was that the uniqueness of the department is that out of 351 cities and towns, only 57 have a department like ours. And they've been around, these departments, since the 70s. I don't know if a lot of them stemmed because juvenile delinquency was on the rise at that time. I know when I was in Shrewsbury, that was the main reason it got kicked off. But the beauty of it is we're in town hall. We know all the players in town. And as soon as another department refers someone to us or a community organization that we work with, we can immediately connect with other town departments, with other community organizations, and swiftly get people some help that's desperately needed. Yeah, so I wanted to mention that because a lot of people don't know that. And I get the satisfaction of working in such a caring community, and you know, we're not alone in the department. We can reach out to other departments to get help for residents. I have, and I can actually email this to you. In the report, I didn't include the specifics about our programs. And so Bob Reed, by the way, do people know Bob? Have you ever met him?
Good evening.
Okay, there he is. Let me grab those. So every year I categorize mental health, case management, collaborative partnerships, and referral information. And mental health includes interface, crisis services. I also do a lot of consultation, and then any ongoing cases that we have to bridge them over to interface. So under that category, we helped 50 residents. Case management is skyrocketing. We had 92 residents that we helped. That included SMOC, getting them help with food, with fuel, homeless intervention, and scholarship programs for kids to go to camps. Um,
Question,
that-
June, can I ask a
Yes.
clarifying question?
yes,
The 50 and the 92, are those two different groups of residents, or is there some overlap in those two groups?
I think there's very little overlap. It's, yeah, there's very little if there is any. So did they get both services? Is that what you're asking?
I was just trying to understand, you said there was 92 residents that you did like the case management for?
Mhm.
And then 50 other residents, was it that you were doing other things for?
Yeah, mental health. Well, I categorize it as mental health. So I get a lot of calls where people,
I'm just wondering if there's overlap in those people, or if the 50 people are different from the 92 that you helped, or if there's some that you gave both services to.
yeah, I'd have to look at the list. There might be a few that got both services. But I wouldn't know about the interface cases because they don't give us that information, you know, if their cases get additional help.
I thought in the past we did get the data from Interface on
We
how,
get data, yeah, we get data, but not client names or anything like that. Yep, we get data from them. They're really good about it. Thanks for asking that. Then we have collaborative partnerships. 163 residents that we worked with received the backpack program, the food pantry, the holiday program, youth scholarship program. We had a couple kids that got scholarships to programs, and Trinity Church and Interfaith Network has been really supportive to our residents. And Trinity has really been very, very helpful. Especially, they've done some work on somebody's house who's in a very difficult situation. Whatever we need, we call them and they come forward with it. So it's a really important partnership. And then there's the Helping Hands program. So people will call us to get a wheelchair or different medical equipment to help them. Some people just get out of the hospital and they need a wheelchair or crutches. So they call us and then we get in contact with Helping Hands, and there's 3 people on the committee who immediately call the people back and meet them at the barn out back and give them the equipment. So that's another important piece. For referrals, every year, we have people call into us with various needs. And this year we had, it's me full-time and Doreen part-time. So we're down a half-time staff person. So 717 people called us between Doreen and I, and we gave out 842 referrals and or linked them to different organizations. So that tends to be also a big piece of what we do.
June, can you repeat those numbers? Because I'm just taking the minutes and I want to make
Oh,
sure. that I
sure,
have it
sure,
accurate.
sure. So it's 50 mental health, case management 92, collaborative partnerships 163, and 717 people called us for referrals, and we gave out 842 referrals. Thank you. Thanks for asking. Okay.
Last question, was that in a whole year time period? That was your 1 year? Data?
Yes,
Okay.
yes, yeah. So this is very early on in discussion, but there's a chance that we may be moving offices upstairs. Our vets agent is going to be housed now at the senior center, which is great because I think there's more needs there and probably more people walking through. So we haven't had a chance to look at the space yet. We're going to look at that, and it would be up where DPW is, and work with them to try to, make this work. And I'll
I can
keep you-
explain a bit if you like.
Sure.
We, as you may know, the town engineer, Fred Litchfield, is retiring. And we want to implement a plan that's been discussed for some time, which is to create the position of assistant DPW director, which would also include some of the engineering responsibilities that Fred has. This creates an additional position in the DPW offices, which is already pretty cramped. And we think it makes sense for them to move down where Northborough Extended Day is, and also where Youth and Family Services is. So they will have more room and make that switch. I think they could use the additional space. There appears to be an office, or maybe an office and a half, that isn't being used presently, which they can certainly use. And we believe that there would be enough space in the present DPW space for those two departments. Well, one is a town department. Northborough Extended Day is a private group that we expect to continue to have space in the town hall as well.
Thank you.
Can I ask a quick question?
Sure.
If the half position were to fill in Northborough Youth and Family Services, or the ARPA money were to come through for that additional full-time space, would that still allow office space on the third floor for those additional employees?
Yeah, I believe it would. We can talk about that extra position. I don't know whether that's on your agenda tonight, but we can discuss that. But I believe there would still be enough space.
Any other questions about that? So I sent you all a copy of the current bylaws for the Youth Commission. And, I think Jen pointed out some things and I saw some things, and Jen had asked how we can change that. And I checked with the town clerk, Andy Dowd, and he said the way that works is all members get their comments and recommendations for changes and give it to Sherry. And then when we decide on sort of the first draft of it, then we finish it off, and then it goes in front of town meeting. So they would vote on the bylaws. So it's good to get that answer. Thanks for questioning that, Jen, because I didn't know. But right now, what happens is all the policies and procedures still go back to the open meeting laws. So
I think my question was pretty specific, and maybe just for clarity, I was asking if June is not available, like for
Right.
whatever reason, does the commission still meet? So now I think my
Yes.
understanding is, yes, we should
Yes.
be meeting whether or not June's available. So I
Yes.
just was what I had originally asked.
yeah, unless there's not a quorum.
Yeah,
Right.
we would
Which
need
is true whether or not you're there, correct? Right, okay.
yeah, my understanding, what I'm clear on now as the chair, is that we would need to still post the meeting. We would still need to have the time frame allowed to be able to post the meeting in time for the public to be able to view it or attend. And continue to follow those bylaws in order to meet it as a commission, but we absolutely could still meet as a commission. So that's just something to keep in mind, because there is, I know the day time frame is a part of it. So I think it's two full days at this point in the bylaws that we would need to post minutes and have the meeting scheduled.
So the other thing we wanted, well, before I do this, under board members, Erica is going to talk about a program about that we're looking into together to do. So that'll come under, you got that email from me, Sherry? Okay, great. So you all got a copy of the Collins Center report. So wanted to get your thoughts on it.
And in order to do this as cleanly as possible via Zoom, if you guys can just put your hand up if you have something that
You
you
skipped an agenda item. Sorry. just-
Oh, yeah, the recent and upcoming events. Thank you. So there's some events I've participated in town, and there's some upcoming ones that I know, Sherry, you've talked about how the Youth Commission could get more involved in some community events. And last Friday night, I went to International Night, which is run by Lonnie Satir of the school and Rhoda. Both of them are fantastic individuals. They work in the English as second language group in the schools. And about 3 years ago, right before COVID, they had done this. And it was a fantastic evening. Lots of people came. They brought all kinds of ethnic food, and they invited me again for this year, and we set up a table, and it went really, really well. I'm just in awe of those two, how they can bring this together. And it was really nice because there's a lot of families we worked with that said hello and, you know, showed me how their kids are growing up, and very, very nice atmosphere there. So
I was there too, June.
Oh, you
I was
were?
there.
I
Yeah.
didn't-
Yeah, I
Oh,
know. I kind of saw
cool.
you. It was a very crowded event. And
It was, wasn't it? Yeah, it was great. Okay, thank you for pointing that out. So the Collins Center report, people get a chance to read it?
So what I was saying is if we could,
I'm driving. You had a couple other things that you were presenting at mental health presentations, you had said, June. I was just really interested in what those were. That was on the agenda.
Oh, yeah, yeah. I've been asked to go to Trinity Church to be on a panel, and it's about mental health issues, and I will be covering the part and answer questions about mental health, but there's also going to be a consumer there that's accessed the services, in, you know, not just our services, but other services. And actually I don't know who it is, so I don't know if they've
I can, June, I
Go
can
ahead.
add a little bit to that too, if you want.
Great. Please do.
So Trinity is becoming a WISE church, which basically means that they are being focused on making sure that their members have what they need mental health wise as well, and that they give them access to resources and numbers and things like that. So they asked for a panel of people to present. One person presenting talks about how to get the resources, things like that, and what is available. There's somebody else that is talking regarding receiving services. And there's going to be another person speaking about being the family member of somebody caring for somebody that's receiving resources. It's going to be a panel discussion with questions. So that anybody can come. This isn't just for the church community. This is open to the public. So the public's been invited, it's been advertised, and people can come and hear about the various different aspects of having mental health things going on in your family. Sorry, I'm admitting Landon back in.
Mhm.
So that's what that is. Yes.
Yeah. Lorna Helms is the one who contacted me, and she and I have been playing phone tag. So she was going to get more into depth, but thank you very much. That gives me a good overview. I just always say, yep, I'll come, I'll be there. So it was really nice to get back out in the community too with International Night. You know, they all really missed that evening, and because of COVID. So you can see the life coming out in people now. And it's nice feeling.
Okay.
Thank you, Jen, for keeping me on track. My agenda's down here, so it's hard to see. Thank
right.
you.
So I'm going to ask, because I'm sure plenty of us have comments or questions about the Collins report. I'm just going to ask that you use the little hand raise thing so that I can call on people to kind of make this as clean as possible and make sure everybody is getting a chance to speak and be heard or ask their questions. I can start. I can open the floor. I read through it. There were a couple of things that I thought were interesting in the way it was written, and kind of pieces that I put together based on the information that I was reading. One of them, I did think it was interesting. The need for additional things was being called for, but at the same time, it was making note of the fact that there's a staff shortage in the department. So they didn't connect the two in the report, which I thought was a little interesting because it was clear that some of the things written are a lack of an extra support person to perform some of those functionalities as part of the committee. So that's kind of one of the things that stuck out for me, is I felt like it almost reiterated a lot of what this group has been saying in terms of what we would like to see offered, what is offered, and what could potentially be offered if there was availability of more staffing to run some of those programs or other functionality of the department. I will add, it's a weird time to add it, but I will add, as a result of this commission, talking about the need for a new moms group, I went back to Trinity and there's been one going on there every Monday. The people there were happy to get one started, and we've been running a new moms group out of Trinity on Monday mornings. So
That's fantastic.
So I appreciate
Great.
the group mentioning it. So
Mhm.
hopefully we can continue to brainstorm ideas like that and come up with more things. But I'm going to open the floor to other people. So if you'd like to say something, please just use the little hand raise. Erica, I saw. Okay. Yeah. Go ahead, Erica.
Hi, thank you. Can you hear me okay? Oh, okay. So I had one question. I agreed with what you said, Sherry, as well. My question is under key recommendations. And it says, create a comprehensive data tracking system for all departmental work. Where are we getting the numbers that June just briefed, if there's not one already? I guess I'm just kind of confused on, do we not have one? Do they want a different one?
Yeah, I can start to answer that. We do have a way of doing it. We use an Excel sheet to add these various programs up. Mary, the consultant, said there may be better programs to do that. And Becca Meekins has said that she talked to the MIS director and they're going to help us with that.
Can I add to that? Because I read that and my husband is in tech. So I said, my initial thing was, and this is just because it mentioned the Excel portion in the center report. And I said, well, that's funny because even when I was in college, if you were a social service major, you were not learning Excel spreadsheets. That was not part of what your degree was. And my husband's response was, well, you're not going to be using an Excel spreadsheet if you're getting lots of numbers in. What you want to use is a special program for tracking. So to me, that's a need for the department, right? Is a special computer program for social service type of things where you can track data, because that's out of a tech person's mouth, basically said,
yes,
there's no way to do that in an Excel spreadsheet cleanly. So
Salesforce is what comes to mind. I used Salesforce.
But I think part of the issue is, yes, maybe we do need a system, but the issue is, how do we feel about those numbers that June's reporting? And when I asked her if there's overlap and like not knowing, like, to me, that's troubling, right? And that's, I think the report really
That's-
talked a lot about that. And, you know, how are we saying what our need in the community is, and when we don't even know like who we're working with, really?
Well, I know who we're working with, but I don't have the list in front of me. So I would have to look at the list of people that we see.
And I feel like we have been given data on different people. And I know, Jen, one of your thing is where overlap may be happening. Which I think, again, that's one of those things is very hard to show in an Excel spreadsheet, right? Like, where does overlap happen? Where are these programs? Which is why a specialized program would show you this person is receiving, you're checking X, Y, Z, you know, whatever. But I do think we still have shown the need in the community. We've shown the data points over a number of years that show the growth in the need from the department. And I mean, I think my argument too is anything you listen to regarding social services in any type of national outlet is telling you, you don't necessarily have to have concrete data showing you that the rise in mental health for people in communities has been raising over the number of the years is at an alarming rate currently. So for my thing, I'm still a big proponent of you don't wait till there's a fire, right? You protect your
Well,
health.
actually, we do have data there. We do have the data that our students are, you know, having higher than historically we've ever seen levels of anxiety, depression, and suicidality. So we actually do have that data. What I just wonder is like, you know, how are the when we talked about wanting resources, just how are we using the resources we have before we add other resources is always the question that I've asked. So I think that's just, I'm not saying where there's not a bigger need than ever. I totally am on board with that. That's what I do all day long, think about. I just wonder, like, how are we using our system also with the other things that are going on in the town, like the health department, the school system, right? Like all of these things working together efficiently.
I don't have the little hand. I don't know where the little hand is. But can I?
Your floor. Yeah, go ahead.
Okay. Just getting back to the statistics, you know, I did talk to June about that with there not being in the last report. She has sent me some statistics on that, and just a concern I have, and I think it's part of the gist of what was in the Collins Center report. I want to follow up on that and see how data is collected, the basis for the statistics that I got. But I'm afraid I didn't read the report quite the same as some of the comments that have been made here. I mean, I don't disagree that there's certainly a need. What troubles me about the Collins report is whether that need is being met, particularly when I see issues with the relationships with family services in the schools, with the Board of Health and other town departments. I don't think that the report is calling for additional people, at least not at this time. I think the way I read the report and their recommendation is that some of the goals that are set in the report and some of the goals that Becca and I have been putting together and meeting with June about need to be met before additional staff are considered. I think we need to deal with the issue that we have now, and I think there are issues prior to adding any additional staff people. So that's my position in a nutshell. I think that the report and looking at an analysis of the overall social service delivery system is important. I think that might address some of the concerns here with some of your board members about the overall need in the community and in the area and how that can be addressed. But I think what's important is the relationship that Youth and Family Services has with the community and with other town departments, addressing that, and then looking at the statistics and how data is kept, how it's done. I'm not a tech person, whether it's Excel or any other programs that have been mentioned here, doesn't matter to me, but I think the data collection and the recording of the data is important just to see whether or not there is the duplication that's been alluded to and how many services are being offered. I think a lot of the services are information and referral, which you already have interface for. So I think a lot needs to be looked at.
Bob, can I just ask about the community relationships? Because I sat on a community hearing basically on the ARPA money. And when I spoke on behalf of Northborough Youth Family Service Commission on my own. I brought my own notes from meetings and I went and I said, listen, I think this is worthy of hearing. and the outpouring of people who run other community programs who came up to me and said, I am so glad somebody's finally speaking up. The number of things that goes on in that department and the different resources that they reach out to and match people with and facilitate has been going on for years. And the department hasn't seen what they needed for years. I mean, I can tell you a number of people that run other volunteer organizations and staff positions in town that had that response to me. So I'm just curious where you're getting the troubling stuff with the community relationships, because the community was out in full force supporting the commission that particular night.
Well, I would support it too. I mean, I support social services. There's no doubt there's a need for social services, but it's just the way I read the report. I think that the connection that's been made or lack of it with different town departments, with the Board of Health, I think that the schools are taking on their own programs and applying for grants to provide services that Youth and Family Services could provide. To me, that's just an indicator of a larger issue. If Youth and Family Services are having issues connecting with town departments, I think it's reasonable to conclude that there's going to be issues connecting with the larger community. And I would think that we would start with town departments.
So I had talked to Bob and Becca. First of all, I think there's some great suggestions in this, but I had talked to Bob and Becca about the report, and there's so much in there that I can show another side to. And in terms of these other departments, I have reached out to one 3 times. We set up a meeting, they canceled it. I reached out 2 more times. So what I'm saying is, I don't understand what these issues are. The Board of Health, we've worked together on tons of families. And so what I'd like to do, and I'm in the process of doing, is writing to Bob and Becca about all the information that got left out in that report. It was focused one way, which is fine, but it left out some really important information. So for instance, and I don't blame Mary for this, she interviewed some town departments, and I had a list of about 10 people to interview that know us inside and out, including Lois Kirk, who's in the office with us every day and sees what we do. And none of those 10 people were called. And so I kept asking about that. And finally, the consultant said, I was told not to reach out to those people. So even though I think there's some good things in this, I think there's some unfair conclusions that do not include all of the information.
Oh, excuse me, June, was that Mary that said that? Mary
Yes.
Charity?
You mean about being
Not
told
being
not
told not to contact people?
Yes.
All right, well, that's news to me. I'd like to follow up on that. If there was some important people she should have spoken with that she was told
Yeah,
not
well,
to. Puzzles
well,
me.
she was told not to from administration, so.
Okay.
Yeah, so there's a lot of pieces like this that are in that. It's interesting that people who have shared some negative things about the department, they were asked, and I'm not saying that we can't make changes, and I'm open to, to look at things differently. But to not ask those other people is a big miss, because they know us inside and out. They see what we do.
I don't disagree with you, June. I intend to follow up on that and find
Okay.
out what that's about.
Okay, thank you.
Question, what are the next steps after this report now? Like, what happens?
And I guess I will follow up with what Jen said in asking, June, you said that now the town is working to get you some type of data tracking system. Right? Is that correct, Bob? That there's going to be some type of new data?
Well, I'm hoping,
Functionality.
as I said, I'm not a tech person, but that's certainly part of the report.
You know,
I guess I'm not clear then whether that's a yes or a no. I'm just, if that's one of the, I feel like main hurdles in showing, you know, exactly what people want to see. I'm just curious if it's a yes or no, that there is going to be investment into a data tracking system or
Well, yeah, I
functionality.
mean, I would expect that there would be. I mean, how do I say it? I guess what I focused on in the report was the delivery of services. Certainly the collection of data is important to evaluate the success and the performance of the department. I guess in that regard, we could look for some help. I mean, if the commission has ideas or can assist in that, I'm open to that. But certainly I consider the data collection and the proper, you know, formulation and presentation of accurate data to be essential in how you evaluate the department.
Okay.
And
All right.
I mean, even sometimes things like just like currently asking June, like how many current open families are you working with like right now? Like sometimes that's hard to get that information. So like, you know, even today, June, the data you shared is so helpful, but that's like your data over a year. Like, I think I
Right.
always love, because we haven't met in a few months, like what's kind of going on in the department now? Like who are the, like, you know,
Mhm.
are you seeing, you know, 5 families for counseling because they can't get into interface? Like what, sometimes you know, we've asked you to share kind of those current things too, because I think we haven't had that update in a while. I don't know if you have that information.
Right
Actually,
now.
one of the, just going over the material here, one of the goals that we've set is for June to, well, I guess we've kind of downplayed Excel a little bit, but whether it's Excel or any other kind of tracking data, to get training provided there and to work on exactly what we've been talking about. These are
Yeah,
part of
and
the goals that Becca and I have been working on.
yeah, and I think an important piece of that is going to be to get a computer person, like similar to what Sherry was saying, someone who knows these systems can come in and train us on them, and spend some time with us until it's up and running.
I feel like, I mean, other local towns, right? So of the 57 that are like us, some of them have got to be using non-clunky,
Mhm.
you know, functionality for tracking the
Mhm.
families that they're working with. I would assume that that is just part of what it is. And I say that, and it's probably a small percentage only because I know my time in social services, there's never any money. So getting those fancier things to do what you want to do doesn't always necessarily come. But there's got to be towns who have a program they're very happy with that works to track.
Sherry, I definitely agree with checking with the other towns, but, and I'm no expert, but Salesforce might be something to look at. I use that in addition to Excel. And what's good with Salesforce is, one, I don't think there's a fee. So that's always great. But like if you put in a name, Jim Smith, and you saw Jim Smith for one thing on March, 25th, 2023, if you saw him for, like, say, food insecurity, at the end of the month, it should automatically track how many people you saw for food insecurity. And then if 6 months later, you see the same guy for, a backpack, then it'll kind of highlight him again, and then you can just go back in. And what you can do, which is helpful, is you'd have like the family name and then each child. So you could say, okay, we've helped so many.
Mhm.
Like I said, I'm not the expert on it. I do use it, but the biggest hurdle with that is, one, to remember every phone call. I get this all the time at work. Every phone call, they want you to monitor in social services. That's just impossible. And to set up the database it's time consuming because you're going to put all your current customers or clients into this database and everybody. And then what we did was we just started fresh. We added, birthdays and stuff like that, but we didn't add any of the previous services because I think I'd still be doing it years later. But that, that's one that I think is pretty easy to use. Just throwing it out there.
Yeah, Erica, would that also track things like not just counseling cases, but case management activities? And it does?
Yes. So
Okay.
it can almost track anything you want it to.
Okay.
It gets tricky because they give you like a template.
Mhm.
And you can go in and put some things in and put some things out, but it's cumbersome.
Mhm.
So for example, I use it with my Families of the Fallen. So I needed, date of death, where the conflict occurred, all these things that just aren't going to be in their template. But now it's great. Like I send birthday cards out every month. So I get a list of all the birthdays. And I update at least, when I go and do that, I update, okay, Jill's doing great. She's going to this college. We've done this much. And then I could just pull up her file. So that's one to take a look at.
Do you know, Erica, just out of curiosity, because I'm assuming it would be important for this, does it have the HIPAA coverage that might be required for this?
I would have to look.
Okay.
I just haven't.
That's my only other question, because I know with
Yeah.
what my husband deals with, sensitive information, there's a very
Yeah.
strict HIPAA regulation that goes along with the storing of all that data. So
Yeah, I'll take a look.
I feel like we're getting derailed because I'm not sure that we're going to decide on a program today, but I feel like I want to mention too the reason why June, I want to know this information because I think it helps us support what the work is that's happening.
Mhm.
And I think too, from the work I do, and I have to say I am a social scientist and I am a numbers person too. So I do both. And I think if we can say we've helped 20 families fill out the fuel assistance form, and that was very time consuming. Maybe we need to say every 2 months, we have a program where we invite people in so we can do it one time for 20 people instead of 20 times for one person each, right? And that can really increase our productivity. So that's why I'm asking these questions, because I think then we can say, how can we use the resources we have most efficiently? And what are the things that other people are already doing that we don't want to duplicate? And where are those areas of need within our town that we're really, not meeting in other ways?
Mhm. Yeah, and we have that information, but number of people that got fuel assistance, and SMOC also gives us how many people from Northborough got help and for how much money did it bring into town. That's why we have a program that's been helpful that the town purchased that's been helpful for clinical cases, but now that things have shifted, I think it's a really good time to look for another program that would better meet our needs and be able to flesh out this information. But I'm not a computer person, so I think of getting I do well on the computer considering I've never been formally trained, but I think we need a strong individual that can help set this all up and then train us on it, that will meet the specific needs of, the uniqueness of human services, the case management.
Hi, I'm wondering if I could pop in here. It's Gretchen Bean. I know you can't see, I'm having some trouble with my video, but hopefully everybody can hear me. Bob, Becca, we've not met. I guess I have a question for you. in looking at the Collins report, and I'm just noticing things like, let me see if I can get it on here. Stuff about, provide assistance to the youth services director with organization and time management. Is the vision that would be coming from you all, or is that more, I guess I just wondered what you made of that kind of the feedback there.
The recommendation or the feedback?
Recommendation, I guess it is.
Well, I think that the director needs to get what help she can to be able to succeed. I think
So
that.
this is Joan. Oh, I'm sorry.
Oh, go ahead.
I'm sorry. This is Joan speaking. So I was just wondering, will she be able to go for training for this organizational type of need that was reflected in the report?
Well, I believe so. I mean, it does mention training for,
Good.
I can never find the right spot when I need it, but it did recommend training for in more than one area. And, I'm all for staff training. I recommend that to any department if they can find that useful and be able to help them in their abilities. So I guess the short answer is yes.
Okay, so all she would have to do is really find a course and then present it to you for approval for her to be able to take it?
Yeah, well, that's basically it. I mean, a relevant course, something that's in line with the needs that we have, the training that we need to answer some of the issues in the report, certainly.
That's great. And if I could just ask two other questions that I pulled out from the Collins report. Are there any recommendations how to address, or maybe this isn't even true, their relationship with the school and also, or schools, and also how is it going to be addressed about overlapping meetings? So maybe if June doesn't have to go to all these meetings because somebody else is, it'll free up some time for her.
If I can
I'm sorry, June, go ahead.
That's okay. I had a meeting with, I'm very open to suggestions and feedback. Sometimes when there's statements made and there's not a lot of detail in it, it's hard for me to understand it fully. Not that I don't understand it, but to grasp all of it. So I met with one of the leaders at the school, and the concern was our capacity, Northborough's capacity versus Southborough's capacity. So in the school, which I agree, wants, like for instance, the after-school program, they want a preschool program and after school. And right now that can't be done because there's not enough people to go. So anyways, they want it to be equal, Northborough and Southborough. And so this person said they want us to do these programs, come in and out of the school. Well, first of all, I'd be glad to go in and out of the school. I was instructed not to do that. And I explained that to the person. And then when the person started talking about all the programs in Southborough, and this is the part, I don't know how to get this through to people. They have 4 full-time staff. There's me, and I've been here alone in terms of the clinical staff for 1.5 years, because it's hard to fill that position because it's not competitive. There's no benefits. There's no way we can compete with a town department that has 4 full-time staff. And then there's me, and this position, actually, part-time council position, altogether in the last few years has been vacant for 3 years. So, and people know how I feel about, wanting to increase the staff. The other piece that wasn't that wasn't included. And this is what I mean. I'm not criticizing Mary, but there was a lot left out that was important. And the piece about, I wrote for about 10 town departments, I put in how much staff they have, comparable departments. We had 1.98. Every other one had 3 and above. And Southborough has much less population than us. It's almost half of what we have. So I just think it needs to be fair when things are compared. And I also.
Oh, yes.
June.
When you explain that, I'm sorry, when you explain that to the person that you met with the school, do you think that will resolve the relationship issue? Letting them understand that you definitely do not have the same staff level as Southborough?
Well, I think that's their goal, though, to get there. They want to get there.
But they have to understand that if you don't have the staff, you can't do it. So do you think in just explaining that to them, and will that resolve what Mary is calling a relationship issue? Or are there other things that need to be addressed?
Can I speak to that?
Please.
It's not an issue of Southborough or any other town. I'm not thinking about those other towns when I look at the Collins Center report, and I'm not expecting Northborough to compete with Southborough. I think that and I understand that Southborough has more people for one thing, but whether they do or don't, it's not an issue of comparing Northborough to other communities. It's issues within Northborough that have been identified by the report. We met with the schools also. I don't want to speak for the schools, but I think that the issues that the schools have with family services also have nothing to do with staffing and competing with Southborough. There are other issues. I just don't want to speak for them, but this business about comparing youth and family services to Southborough is simply not the issue.
Yeah, and I wasn't comparing it. It was someone else. And the other thing about this is if someone tells me there's an issue, we talk about it. I don't know what these other issues are. And I think people know that I was not in the first meeting. My department paid for this, and I was left out of a lot of it. And so it really, to me, it seemed very skewed. And I'll be writing to Becca and Bob.
Joan, you're not on
I'm
mute.
gonna say that I've expressed an issue in the past, and I'm gonna express it again, and that's the issue I've had with some of the confidentiality that's come out of this department in terms of protecting our children. So I've shared that with June in various ways. I've shared it with this commission, and I'm saying that, and I'm in that dual role of being a member of this commission, a resident, and also a school administrator. So it's a little bit uncomfortable, but I have shared that.
Yeah.
Jen, do you mind if I dig into that? Because I don't recall being at a meeting where I felt like there was confidentiality that was breached at any meeting that I have attended.
I think that may be a question for you and Bob to address. I'm not sure.
Well, I think just by the nature of those types of issues, they're not made public.
Okay, I guess I'm confused because there's never been any names used in any of our meetings. I work.
I agree.
There's never been a name. It's been, I feel like, Jen, you've asked for what are the issues currently in town. And then June has explained we're dealing with a couple people with homelessness. We're dealing with families that maybe have dealt.
I'm not going to go into it for the sake of not breaching confidentiality again, but I do think that June and I are both like licensed mental health professionals. So we have a different level of confidentiality than other people. And that often means, it doesn't just mean that you're not saying the name. Sometimes you're sharing other information that can be inappropriate. And there've been other ways that can that
I'm
information
fully
should
aware
share.
of that. I'm fully aware of confidentiality between any job that I've had with kids. I'm under the same types of confidentiality in terms of what can be shared and what can't. And I honestly cannot think of a meeting where there was any type of breach of confidentiality in terms of a family, because it would have immediately raised a flag for me.
Well, I don't know if it's
Disagree.
appropriate to
Okay.
continue to discuss it, but there was an issue.
I'm wondering if maybe we can just get back to the Collins report. I guess I wasn't quite finished with my question back then. I just want to make sure. My hope is that the June and the whole town hall administration, I hope that that are working with some of the recommendations from the Collins report and together. I guess that's what I'm hoping is the case. And I just want to confirm that you're all looking at the report and you're all kind of working together to try to take the recommendations that have been given. Is that an accurate assumption for me to make at this point?
It is. We have, I believe, been working together. We've had several meetings with June. We've established goals. We're in the process of firming them up and getting other input in establishing goals, but we need those goals to be met. I mean, we need the Collins Center issues to be addressed. And I think there may also be a role for the Board of Youth and Family Services to help out here as well, because these aren't recent issues.
Certainly, I appreciate that. Yeah, I mean, this is the first, I've been on the commission a long time. We've not had the report until just now, but I don't disagree with you. I think that there's a place for all of us. I just wanted to make sure that it's being looked at as a whole group effort. So I appreciate that. Thank you.
Bob, do you want to expand on, because I think it makes sense. I try to keep us to 8:30 to be respectful of everybody's time as chair. And so I think if you think there's ways that the commission can help, I think this would be a great time. If you have recommendations of where the commission could be helpful, I would love to hear those, because I think it'd be great action items for upcoming meetings.
Well, perhaps as an issue of accountability and, looking at the statistics, asking questions about services, monitoring the progress that's coming along with the Collins Center. If some of you have resources or ideas on other similar agencies that have the data tracking that we've been talking about, something better than Excel where we started, that would be a good place to start. I mean, those are my suggestions. As I think I mentioned early on, my background is not social services, and this is something I'm trying to get a handle on. So if there are things that you could suggest to me in ways that you feel that you could help out in trying to address the issues in the report, I'm very open-minded about that.
All right. I think those are some great ideas to add to a future agenda. And so you're open to us sending an email, like if I hear of a good system, you're open to us sending an email saying, hey, maybe check out this particular computer system or whatever.
Sure. I don't know if I'm the one to evaluate whether it is a good computer system or not, but certainly it's something that we can follow up on. Whether it's the commission itself to look into this or assisting June in looking into it. But if that's an area where you would like to explore and see if there are better means than Excel or whatever is being suggested in keeping track of the data, I think that's an excellent way to start.
Okay. All right. So I want to open the floor because I always try to make sure that any other issues, concerns, questions, possible agenda items for our next meeting, people have a chance to add those before we run out of time or before we take up too much time. So is there anybody?
I was hoping that Erica could give a brief summary of the new program.
Sure. So the program is called PART, or Positivity and Relaxation Training. And it's a 9-week online course through Mass General Hospital. And it's just geared towards how do I put this? The program itself is proactive. So the guidelines are to create healthy families before they become unhealthy families. Now, we all know that that's not always the case. So I will start the training. The next one isn't until September. And what it looks at, it's very similar to one that the schools had done. It looks at relaxation techniques, exercise, meditation, all these various self-help skills. It's geared towards adults. However, they will weave in some age-appropriate curriculum, for lack of a better term. So for example, for the online program for, say, middle schoolers, they would get a kit in the mail, and there's a lot of hands-on activities, a lot of different techniques, a lot of like recipes and just things along those lines. Ideally you get the whole family involved, but that can be a little tricky. So I'm hoping to hear more in the summer. Basically, once I was approved to do it, they just said, all right, this is what it is. We'll reach out more. So I'm hoping by the fall to have a lot more information and possibly be able to, do something maybe in around late fall, early December.
Question, Erica. So this is something you're getting trained in, and then you would do it for our town children.
Yeah,
Okay.
obviously not for the schools, because I'm not I'm not a school administrator or anything. So so I work for a nonprofit that works with families of the fallen, their children. So as you can imagine, the stress level for them is very great opposed to just everything else. So my board of directors said, go ahead, get trained on this. So I will be offering it. I'll be offering it. I can do it as a volunteer here as well. Home Base, which is part of the Red Sox Foundation, it's a program that they've used. So that's where I got connected with them. So, I'm excited. I'm excited to start the training and kind of learn more about it.
And it'll be for middle and high school students?
I don't know yet.
Okay, you're not sure, okay.
I'm hoping they'll certify me in all ages. I know there may be some additional training for some of the kids. So for example, at Home Base, they have a whole curriculum geared towards military families. So they'll kind of make it what you need as well.
And Erica, would there be cost to it? Because, we may be able to chip into the.
So that's my question. I would not charge a fee, obviously, but materials. So that's my question, is the materials.
Okay. Do you know roughly what that costs?
I don't. I can ask
Okay.
a friend that actually started a few months ago.
Okay, great.
So it would be, the materials for the participants.
Sounds great.
And I'm also going to a luncheon at, I don't know, Forge Health. Is anyone familiar with that? So it's in Devens, is the location I'm going to. So they provide mental health strictly for veterans, first responders, and their families. So when I learn more, that may be another resource, because if as we know, they're a high stress position. So if you did have a police officer or a firefighter, I'd love to share that information too, just as an additional resource.
That sounds fantastic.
Cool. Thank you.
I'm also hoping to bring to Trinity, hopefully by the end of the summer, NAMI groups. I plan to hopefully get trained over the summer in order to run NAMI groups. And Trinity has already offered up the space for me to run free groups.
Great.
So I'm hoping to get trained over the summer and then would be facilitating. Primarily, my focus would be on providing groups for people caring for those with mental illness. Because I feel like there's a big gap in those individuals having a space to be able to talk and speak with other people going through the same thing they're going through.
And that's something we could probably help out with.
That would be great.
I was involved in setting up, you may have heard of it, the Parent Professional League. It's called PAL.
Yes, yep, I have heard of it.
Yeah, and about 30 years ago, when I worked for the Department of Mental Health, this idea came up. And I had a parent that we worked closely with, and we got it going in the Department of Mental Health. And what was fascinating is when we met, when the parents and the professionals met, they had no idea how we don't have the power to do a lot of stuff. And so it brought out a humanness in us, and people got to understand what it's like to be a parent of someone like that. So it was wonderful, and I'm glad to hear it's still going.
Are there any last thoughts before? So if I could ask for our next meeting, I'd love for people to come with ideas of ways. I think I struggle as a chair of this commission only because I know we're all people who are working full time and trying to also come up with new ideas for programs and things like that. So I would just love to try and come up with some ideas that this commission might be able to help with over the summer, starting in the fall, whatever it may be. If we need to get organized and plan something for fall, whatever that is, I'd just love to kind of have a round table on what those ideas could be. Because I think that's our biggest struggle right now, is that we all want to help do things, but we all also work 40 hours and have children and other things going on in our lives. And so how best can we continue to support this department and potentially add some value?
Yeah, also, June, maybe some specifics about what sort of progress has been made toward some of the recommendations in the Collins report in the month between now and then. Just, again, just curious about support you're getting from your administration and, from here, what people are, what kind of progress is being made.
Great. Sounds
Jen,
good.
go ahead.
Oh.
I see your hand.
I'm sorry. I just am realizing that the next meeting is the same meeting as, is the same night as one of the last combined school committee meetings. And I know we had talked about trying to avoid conflicts with major school events. I'm just wondering if there was any ability to reschedule our meeting to the next week.
So the next one is the 22nd, correct?
The last day of school, yeah.
That's the last day.
Oh, it's not the 15th?
No, I think it's
No. I
15th.
mean, if we postpone it, Jen. So the 22nd for me, I already have because it's the last day of school, I have a college visit planned with my kiddo. Because it's out of town, I don't think I will be back by 7 o'clock. I'm happy to do a
I'm
week
just wondering,
earlier.
does it have to be on a Thursday? Is that the rule?
I think because people's schedules plan for Thursday. I know for me, I can't speak for everybody here, but I know for me, I block off Thursdays. Could we do a week earlier for you?
I don't want to make it just about me. I was just saying I could, but I mean, these are busy months. So you do the normal meeting and I can maybe try to be up.
Well, my suggestion would be if you could do the 10th, that we vote to see if the rest of the group was in favor of moving it to the 10th.
You know what, I think I'll let you work all that out. Thank you for letting me participate.
Thank you.
Okay.
The 8th, do you mean the 8th?
The other thing you have to
Yes, the
keep in
8th, I'm
mind, Sherry, there's spots here that are taken up with
Oh,
Zoom hosts.
Right.
And so we're locked into that Thursday, so we're guaranteed to get a Zoom.
You know what,
host.
I retract, just keep it. I'll either, I might come late then. That's
Okay.
all. Okay.
Okay.
I motion to adjourn the meeting.
I second.
Oh, may I ask a question
Joan.
first before we adjourn? Hello?
Yep, go ahead, Joan.
Oh, thank you. So in reading through the Collins report, why I was asking the specific questions was at the end, the recommendation was to not hire anybody else. Does that mean we can't go forward and ask for the halftime from ARPA funds, A, and B, does that mean we can't even go for the halftime person?
It doesn't, Joan. Our request has already been submitted. Select Board also has the Collins report, so they're free to do what they see fit at this point. So
Yeah,
basically everything stays as it is.
It
I
does.
mean,
okay. Do you think it'll influence the board negatively or quite negatively in allowing the ARPA funds to go towards the halftime person?
I personally wrote how I felt about the Collins report to the Select Board, only me, my name. I didn't include anybody else in the board. Because I personally felt that although there were lots of recommendations and they were not calling for an extra person, that in a lot of the wording of what they were recommending would require an extra person. It just didn't make any
Right.
sense to me. I felt the report was a little wacky in that way, because they were recommending several things that you're like, but you're already saying this person doesn't have that time, but you'd like all
Yeah.
these extra additions. So I do
Well,
think it
thank you for
depends on how you read the report. So
I know. Okay. And it's, well, too bad I didn't ask this when Bob was there, but it doesn't mean they're going to freeze the half person rec that we have now, right?
no, that person is, I mean, it's just a matter of trying to find somebody to fill a non-benefit position, but that position stays open.
Yeah, and
All right.
what's unfortunate is that's been pulled out of it's not advertised anymore. It's been about 6 months. So that's a problem too. And I am going to suggest that it's the time of year where colleges are graduating. So
Yeah.
so I want to get it through Becca advertised there. I don't know why it was stopped.
Well, June, I'm going to go out on a limb and say they used that position of non-working pay to pay for the Collins report, which doesn't make a whole lot of sense to me, but that is how that went down. And so if you're using the salary that would have gone to that person, it makes sense to me that they then pulled the advertisement.
Can you still go forward, Joan, and ask them to advertise it and see what they say?
Yep.
Thank you.
The
Sorry.
motion's still out there. We got to vote on the meeting.
Oh,
I'll
Gretchen,
say-
were you motioning or were you trying to speak?
I was just trying to see if we had to move again to end the meeting.
I'll just re-motion to adjourn our meeting.
And I'll
I'll
second it
second.
again.
Thank you, everybody.
Vote.
Thank you.
Meeting is adjourned.
Okay.